In everyday clinical practice, the word average carries an implicit assumption that the average patient response is also the typical patient response. This assumption is misleading. A population average treatment effect does not describe what any individual patient is likely to experience. The average is a property of the population, not a prediction about any person within it. The population average treatment effect is a probability-weighted sum of individual outcomes across all patients in the population. Each individual outcome is weighted by its probability of occurring in that population. This definition contains no notion of any individual patient's frequency of response. It makes no claim about what a specific patient will experience. It asserts nothing about typicality. It is a mathematical object, not an empirical observation about individual patients. The population average treatment effect can be a balance point that is never realized by any individual patient in the population. The average alone cannot describe interindividual variability, nor can it characterize the risk any single patient faces. Population averages can hide the structure of how patients actually respond. The distribution of outcomes across individuals is not recoverable from the average alone. Consider a treatment where most patients experience small harms or no benefit, while a small subset of patients experience large gains. In this population, the average treatment effect can be positive, yet most individual patients have negative outcomes. The population average treatment effect and the lived experience of individual patients are not the same quantity. The gap between them is not a rounding error. It is a structural feature of the population risk distribution. The population average treatment effect does not capture interindividual variability in response. It does not capture uncertainty about any individual patient's outcome. It does not capture tail risk from rare but severe adverse events. It does not capture extreme outcomes at either end of the response distribution. The population average is one scalar extracted from the full population risk distribution. Multiple distributions with very different shapes, differing in variability and tail structure, can produce the same average treatment effect. The population average treatment effect is mathematically precise and indispensable as a summary of population-level evidence. It is also incomplete. It does not characterize interindividual variability, uncertainty, or the risk any individual patient faces. The full population risk distribution, not only its average, is required to reason about individual outcomes. The average is a summary of the distribution, not an explanation of individual patient outcomes.